This is an important message for all New Hampshire residents from Steve Ahnen, President of the New Hampshire Hospital Association.
New Hampshire's Medicaid program is broken, and this budget is a betrayal of the commitment the state of New Hampshire has made to the poor in our state who we serve in the Medicaid program. It's putting hospitals in an untenable position of caring for our state's most vulnerable citizens, despite the state cutting over $250 million in payments, the vast majority of which are designed to help compensate them for the uncompensated care they provide to those in our community who have no insurance and nowhere else to turn. And it will lead to further increases in the cost of private health insurance for businesses and individuals, threaten the availability of essential health care services that our communities depend on, and result in the loss of jobs and economic stability. The budget that is under consideration can only be described as a massive tax increase on hospitals. For 20 years, hospitals have paid what is known as the New Hampshire Medicaid Enhancement Tax as a means of helping the state generate additional federal revenue that could be used to fund state government. And in the past 20 years, the state of New Hampshire has received over $2 billion in federal revenue as a result. It was never intended to be a real tax. Last year, the state made a number of changes to the DISH program to begin to start paying hospitals for the uncompensated care they provide and to be compliant with federal rules and regulations. And it still generated almost $100 million for the state's general fund. Now, this budget would turn this program on its head by requiring hospitals to pay a real tax who stand to receive very little, if anything, back to help defray the costs of treating those without insurance. In fact, the tax revenue would take the place of the state's obligation to fund that portion of the Medicaid program which pays providers for taking care of Medicaid patients. For almost every hospital in New Hampshire, this tax will exceed what each hospital has paid for taking care of Medicaid patients. And it means that funding that would have been available to reimburse hospitals for the uncompensated care they provide will no longer be there. That's a tax increase, plain and simple. The Business and Industry Association of New Hampshire, which represents businesses of all sizes across the Granite State, has been strongly advocating against cutting Medicaid funding because of the implications that it will have on private health insurance rates that businesses pay for their employees. We already have some of the highest health insurance premiums in the country here in New Hampshire, and this would only make matters worse. The New Hampshire Center for Public Policy Studies recently released a report that shows that up to 25% of the cost of health insurance can be attributed to this cost shift. The Medicaid program is a partnership between the state and federal government, and it relies on the ability of doctors, hospitals, health centers, and others to provide services to our poor and most vulnerable populations. And this budget breaks that promise to the people we serve. It puts hospitals in an untenable position of trying to serve not only Medicaid patients, but everyone in their community. And cuts of this magnitude are going to impact hospitals and their ability to maintain the levels and types of services that our communities depend on, and will unquestionably result in the loss of jobs and economic stability. We need your help. Please contact your legislator today. Tell them that you support your community hospital, and they should too. For more information, visit our website, nhha.org. Remember, we're in this together. Thank you.